We were talking about this earlier. I think Michael and I have known each other since 2016, so quite a while.
Dave Dirks was one of the first people that I met at Castell. Very quickly, Dave and I and our extended teams found a lot of commonality. We really wanted to challenge the status quo in healthcare.
I think both of us are out on the cutting edge.
And that's where our partnership is really unique.
Sometimes we challenge one another. Sometimes we have disagreements about what that looks like or what it means or what the best way to accomplish something is. And in that sort of friction and disagreement and working through that, most of the time I would say we come out with an even better answer.
Not a week goes by that I don't talk to Dave or to Andrew or a member of the Castell management team.
We wouldn't have that level of trust if we felt like Arcadia was simply a data vendor and providing us with a technology solution. It really is a thought partnership as well. We know that they fundamentally understand what we're trying to achieve. They understand our pain points. Arcadia knows our business.
Dave and a number of members of his team are always calling our team saying, here's something that we think you should invest in, whether it's a new product, a new analytical model, a new partnership, a service offering. In 2016, I would say that our mission was to get people healthy. And Intermountain helped us really think about this concept and challenge of how do we keep people healthy?
How do we get a little more proactive, and how do we make sure that we're not just responding to people that are ill, but how do we make sure that we're reaching out to people and try and keep them well if at all possible?
So when COVID was spreading rapidly in 2020, Castell and Arcadia banded together to make sure that they could leverage Arcadia's digital patient engagement tools to help educate patients, not just on what to do if you think you have COVID or you've contracted COVID, but also to help identify patients who had much higher risk of contracting COVID and make sure that they got a personal touch point.
Arcadia came to us very early on and said, hey, we have a set of algorithms that we can use to identify those patients who may be at risk if they were to contract the virus. We're testing those models, and then we also have a way that we can automate that outreach to people. That one-to-one human experience is one of the things that we think makes Castell unique, and one of the things that's really important to us.
What's invisible to the patient is all of the complex analytics and the brainpower behind identifying that patient X needs a phone call.
I would say the end result absolutely is a phone call. But if you think about the power behind that person that is making the call, you can't do any of this without the right data and information at your fingertips.
What Castell has done is given providers the space to do what they want to do, which is to provide care and to provide great care.
It's data in the service of keeping people healthy, keeping people well.